What are the cognitive risks of anesthesia in plastic surgery? When considering plastic surgery, many patients wonder about the safety of anesthesia and its potential cognitive risks. Anesthesia can lead to cognitive changes after surgery, primarily through conditions known as postoperative cognitive dysfunction and postoperative delirium. These issues may present as memory problems, difficulty concentrating, or slowed mental processing. Older adults and those with pre-existing cognitive impairments are particularly vulnerable to these effects. Postoperative cognitive dysfunction, or POCD, is a decline in cognitive function that can occur after surgery and anesthesia. This condition can be temporary, but in some cases, it can persist for months. The risk of POCD increases with the duration of anesthesia. For instance, complex procedures like mommy makeovers, which take longer, pose a higher risk compared to shorter surgeries like eyelid procedures. The type of anesthesia used can also play a role in cognitive outcomes. Both general anesthesia and regional anesthesia have been associated with cognitive decline in older adults. However, the long-term effects of each type are still being studied. Some research suggests that general anesthesia may lead to more significant memory decline than regional anesthesia, but further investigation is needed to confirm this. The complexity and length of the surgery itself contribute to cognitive risks. Longer surgeries and extended exposure to anesthesia increase the likelihood of cognitive issues. Other factors, such as fluctuations in blood pressure and pre-existing cognitive dysfunction, can further elevate this risk. While plastic surgery is generally less invasive than major surgeries, longer or more extensive procedures still carry cognitive risks. Emerging research indicates that cognitive decline may not be directly caused by anesthesia agents but rather by inflammatory responses triggered by the surgical process. Surgical trauma can activate brain immune cells, leading to neuroinflammation that can impair cognitive function, especially in older adults. There are other anesthesia-related risks that can affect cognition. For example, hypothermia during surgery can worsen complications. Additionally, while rare, toxicity from local anesthetics can cause neurological symptoms if overdosed. Prolonged anesthesia can also increase the risks of respiratory and cardiovascular complications, which may indirectly affect brain oxygenation and cognitive function. To mitigate these risks, patient safety protocols are crucial. A thorough preoperative assessment of cognitive status and risk factors is essential. Minimizing the duration of anesthesia when possible, carefully monitoring blood pressure and oxygen levels during surgery, and using tailored anesthesia techniques can help reduce systemic inflammation. Postoperative monitoring for cognitive changes allows for timely intervention if needed. In summary, while anesthesia in plastic surgery is generally safe, there are recognized cognitive risks, especially for older patients or those undergoing longer procedures. These risks involve various factors, including the type of anesthesia, surgery duration, patient age, and inflammatory responses. Plastic surgeons and anesthesiologists work diligently to implement patient safety protocols to minimize these risks and optimize cognitive outcomes. It is important for patients to discuss their individual risks with their surgical team to ensure personalized care.